The tension from the dental work where they overstretched you, you're having some of that dental pain or jaw pain again. Okay, so we'll be doing some needling into like the pterygoids and a few other muscles here today. We'll get that to calm down. Right in through here. This is actually kind of cool. So you're familiar with the zygomatic arch, right? Right underneath that is where we can access and target a lot of the jaw musculature that becomes over tight when you are like grinding your teeth at night and things like that. So we're gonna put a few needles in through here. You're gonna feel a little prick there, and then we're gonna push through. You're gonna feel just a little pressure at that end point. And there we go. Now the other thing that's very beneficial for specifically grinding your teeth at night is meditation and deep breathing to kind of relieve the stress right before. There we go, good. Okay, we're gonna go to the masseter next, so right in through here. Dry needling, like I said, has been researched since basically the 1940s. It's another way to break down collagen tissue that's inappropriately formed. Healthy tissue should look like this. So, for example, on a muscle, it's going to stretch in and out like this. However, if there's too much of a tear like this, the body has a response to bring it as close and back together as possible. So it's going to look like a big clump. That's basically what scar tissue is. And that can lead to like decreases in blood flow to the area, impingements on nerves. And so scars in particular, it's not a really healthy tissue. It's just basically what your body is trying to put down as quickly as possible to keep you from bleeding out or other things. The dry needling, along with other modalities like deep tissue massage, stretching, foam rolling, things like that, they will help to break up the tissue. Now the benefit of dry needling is that it can go all the way down to the bone. So on her, for example, we're actually hitting the bone pretty much with every single one of these, whether that's the mandible or into the cranial skull. When I put them in, I'm putting it in, I'm actually putting a little twist in the needle, and that catches those collagen fibers that are excessively tight or wound inappropriately, and it wraps it around kind of like spaghetti on a fork, and it breaks up what are called van der Waals connections. So that's basically friction. It breaks up those pieces that are too close together and kind of strapped together. Now we're letting this hold in for a little bit, and that actually helps to induce an inflammatory response. It's going to bring more blood flow in. It's going to bring in white blood cells to eat away the excess scar tissue and other things. And at the end, it's going to come out with a healthier, more normal tissue. How does it feel though?
Much better. A lot more relaxed, and my jaw is more flexible. It's
Perfect.
great.
Awesome.